An ILA test for a rightward rotation about a left axis. That is, the patient is rotated to the right about a left axis, which is also described as a posterior torsion. If I'm going to examine such a thing, the patient sits on the examination table and I will palpate down near the ILA. Hence, that's also the name. And there I would find that the left ILA over here is situated a little higher up. At the moment, when the patient is standing upright with the spine held in a neutral position, I understand that the patient presents with a rotation toward the right side. I do not know, however, which axis this rotation is occurring about. Accordingly, I request that the patient first perform a flexion of the spinal column, and when the patient flexes the spinal column, you bring back both bases toward their original positions. The one base located here on the patient's right side remains back. The left one, which is not dysfunctional, can also return to its former position. This in turn means that when I ask the patient to perform a flexion, both bases will move back, and as a result, there will be a realignment of the ILA. Therefore, with flexion of the lumbar spine, there will be no detectable signs. After that, we again instruct the patient to sit in a neutral position. Again, the ILA will be observed to stand skewed, and I would ask the patient to perform an extension. When extending the lumbar spine, this action will cause both bases to move forward together. Note that the left base shows no dysfunction, so it will move forward readily. The right base, however, remains behind and will not move forward because of its dysfunction, and this means there will be a larger difference between the left moving forward and the right staying behind. This pattern would indicate that the left side can advance more readily than the right side, marking a clear asymmetry in forward progression. So I would like to perform a larger rotation, which results in a greater lateral bending. Therefore, I know that if the patient experiences it, we would say that extension is markedly worse, i.e. that it becomes more evident in extension, so they have a right over left. And as noted, that means we have an axis on the left side where the sacrum is rotated to the right, which requires that the right base move back and the left ILA move forward. Theory of sacral dysfunction, right and left.